checking leg length down here just to see which leg is more functionally long versus short. And then sometimes I'll get some soft tissue techniques through the knees and hips. And a lot of times what I'll do is I'll check pelvic alignment / disc form and function. So just push up for me. That's good. Push up. Not so good. One more try. Yeah, not so good. So I'll use these pelvic blocks. It props up the pelvis in the right position and get, in this particular case, an internal rotation just to get that disc freed up at the L5 in the back there. And then I'll get an axial stretch right through here. Open up L5, L4, just like that. We'll go back and recheck the strength. Push up, good. And then let me see your arm. Pull back that way. Just checking muscle strength in various regions. Push back again, pull back, and pull back. This side, do it again. Yeah. And then just turn over for me. We'll check his back and neck. All right, so I noticed he had a couple back issues through here. So yeah, it's slightly inflamed on the right side, L5, S1, and then L4 over here. So a lot of times I'll just go through some stretches just to get that worked out better. I have a table here called a drop table. So it lifts up a little bit, and then I set the tension to it. And then I can push down in the area to reset the disc. Down, down. Good. And then I can feel the flexibility of the hip joint as I'm rechecking. Good. We'll come up and feel a little bit of a scoliotic curve through here, so we'll try to do as best as we can to straighten that. Fixation here at T12, so we'll do some adjustment procedures pushing down through here. Good. Fixation at T9, push down. Some of these areas of the spine, well, every part of the area of the spine deals with internal form and function. So T12 and T9 deal with stress, cortisol, adrenaline, so that resets the nerve supply to that. A lot of times when the patient's face down, feel the tension of the calcaneal tendons down here just to give me some input. He's tight on the left side, so there's more blocking procedures with those cushions. So I'll do that to take the tension off of the calcaneal tendon. And then I'll go back and recheck, and we got it nice and even now. I'll use this little clicker device. It sends input through to the various spinal areas. There's 6 layers of spinal muscles. The person can move the top 3 layers, layer 1, 2, 3. Only the central nervous system controls 4, 5, and 6. So this device gets down to 4, 5, and 6 and resets the muscle spasm. So I'll go through that and just reset some of that. And I just kind of use my hands to feel which areas are in trouble.
Every area.
Every area? Go back and recheck the both the leg length and the calcaneal tension. We'll go back and just make sure there's no other segments that are in trouble. Those are all done. And then over here, there's tension on this side. Over here at C6, 7, which sends nerve signals down into the arms. And so a lot of people with numbness, tingling in the arms, or loss of range of motion with frozen shoulder, etc., have issues. So there's adjustments through there that I can do on both sides. So we just very gently come through and set it that way. And then we'll go to the other side and set that on this side. Good. Usually after that particular time, we use this kind of like massage device to kind of bring the blood and circulation and lymphatic flow through the rest of the spinal areas and kind of iron them out. A lot of times, like in this particular instance, there's a lot of inflammatory issues through this side, we'll use some very mild anti-inflammatory anesthetic soft tissue injections. So I'll do that in a minute for this side because this is in trouble. And then after that, we can do the low back sacrum adjustments to kind of get the range of motion restored on both sides.
So is it usually one side's different than the other because one leg's longer?
Sometimes. In this particular instance, there's a scoliotic curve through here, which we've tried to restore somewhat. But because of the scoliosis, there's usually pressure on one side versus the other.
Okay.
In this particular instance.
Could that lead to the leg being longer?
Oh yeah. Yeah, because the pelvis rotates back and forth, and then that can make your leg longer or shorter as the pelvis rotates up and down.
Okay.
So that's why I got the blocks in there too. So usually when we have an area that's in trouble, like there's the iliolumbar ligament through here, a couple other insertion points for the gluteus medius, maximus, piriformis, etc. that ride through here, we can use a very mild anti-inflammatory / anesthetic to calm that area down. There is some compensation on the other side, so I'll probably get that there too. But I'll show you real quick a very easy soft tissue injection that can just kind of ease that up.
So is it intramuscular or?
Oh no, it's not
more
intramuscular.
superficial?
It's a superficial. So we clean the area on both sides.
I'll blur out your butt crack, don't worry.
Sorry, whoops.
No, man.
I wasn't even thinking of that.
Take it today.
And then we just very gentle, just get in, get a little bit of peppering into the spot. And then like I said, this area has a compensatory mechanism on the left where you can get a little bit of medicine there too. Let me put the massage back on. But that's basically what we do with soft tissue.
That's pretty easy.
Yeah.
And that's not a corticosteroid at all.
No. No, yeah, that's just non-steroid. You can use steroids, but you got to be more careful about it. So I'm just going to do this for his sake, just because it helps the medicine set in there. So usually after the injectables, and we only use those every couple weeks. We don't do those all the time, but it kind of gets in there and lets the ligaments and muscles and tendons kind of loosen up. And then so when you use them for pain, increasing range of motion, increasing stability, etc., that really is a pivotal key for some of those patients. Just go on your side. We'll move the joints now. Cool. Just come over here a little. Give me this. Just hold your wrist right there. Just to relax for me. Relax your shoulder right there. Got it. We'll face the other direction now. Same thing on this side, just to open up the facets.
I felt it just shift out of place completely.
Hold
I
your.
feel better already on my own.
Relax for me. Good. Relax. One more might be there. There she is.
Was.
Yeah, that was really locked up.
I hope this might pick that up.
Yeah. Yeah, so that's kind of the basics of the appointment. I mean, there's more that we can and do, but that's just the basics. I don't know if you have any Q&A or any other things.
Yeah,
But
and then we have the orthotics.
Yeah. So these are custom-made orthotics, specifically cast for his feet. And what we do is I put the foot exactly in the right position, cast it into a foam box. The computer, it's sent to a lab, the computer makes an image of it, and then it's constructed exactly to your foot. We will usually make more of an athletic kind of build, in the sense that it will hold up under more pressure than just maybe going to work or something. It is a carbon flex material that's pretty durable and flexible, so it's not like digging into your foot, but at the same time it's providing that exact support coming in through your arch, which is needed. And then it's got a nice kind of like antibacterial layer here, so if you sweat and stuff, it's kind of like helps with that, and a lot of cushioning, Nightplex underlay, and a nice,
And how do
cushion.
those differentiate from, say, like your Dr. Scholl's at Walgreens or, however it may be, because it's not exact specific towards someone's needs or issues, or?
I mean, I'll try to answer your question. If you're just getting a generic thing, it's not custom made to your specific body. There are some machines that uses lasers and stuff to measure your feet. I like to hand make all my stuff. I don't make these, but I like to cast them handmade. I put your navicular and talus bone exactly in the right spot so I can feel it move the right way. Then I put it in, and then I know it's exactly going to be made for your exact foot. So I that's just the way I was trained, and that's the way I have seen it, help other people the most. So that's how we do it here.
And that'll also help with corrective back issues, or say if someone has one leg longer than the other, or mild scoliosis.
The gist of it is, if you can get the feet in the proper alignment, it works its way up to the knees, to the hips, to the backs, up to the shoulder, to the neck, and then through the whole kinematic, chain.
Do you think a majority of individuals should use orthotics?
I mean, we screen to see if you need it or not. I think if your arch, we do a screening test where if you sit, and then when you go into standing, if your arch falls more than 9 millimeters or something like that, it qualifies you to need that product. But we always screen people to see if that would help them.
And then this would be the mild scoliosis issues that I have, which this would improve.
This could support scoliosis too. This supports a lot of different things, from your knees, hips, low back, all that, and feet and ankle issues too. So they're really a well-rounded product.
Okay.